welcome to Digital Health Talks. I'm Megan Antonelli, and today we're exploring the intersection of artificial intelligence and human-centered healthcare with Eric Smith. Eric's the Chief Digital Officer at Memorial Hermann, and he is working on pioneering work in responsible AI, governance, and digital transformation. And it's setting new standards for how technology can enhance rather than replace the human elements of healthcare. From innovative AI solutions to mentoring the next generation of health IT leaders, Eric brings a unique perspective on balancing technological advancements and compassionate care delivery. Hi, Eric. Thanks so much for being here today.
Hey, Megan. Thanks for the opportunity to be here. Looking forward to the conversation today.
Yeah, I'm excited. We've worked with so many of your colleagues at Memorial Hermann and been down, had HealthIMPACT down at the Texas Medical Center a number of times. So it's exciting to be able to chat with you and to hear a little bit about the work you're doing now. Tell our audience a little bit about, how you ended up at Memorial Hermann and your journey to healthcare technology leadership.
Sure. Probably a little bit of a unique approach. So I am not a traditional healthcare career person by trade. So I actually spent the majority of my career in healthcare or in financial services. So it was one of those, and I probably saw myself mapping out the rest of my career there. I enjoyed it. Great challenges, great opportunities. But like anything else, you get that phone call that makes you pause and think for a little bit. And I think the thing for me that probably triggered it was we're all consumers of this product called healthcare. And you think about all the things that, whether it's scheduling, whether it's showing up, all the forms you have to fill out, you think of the things that, gosh, there's an opportunity to fix that. And so the more I thought about it, and the more I talked to the great folks here at Memorial Hermann and met the team, one, there was a really strong emphasis. It was part of their overall strategy, a digital transformation. And so I joined the team and been here ever since. And so our team has all of our really patient-facing engagement platforms from our app to messaging, contact center, as well as our data analytics, data science, and informatics group. So we've assembled a team here over the past 4.5 years since I've been here. But it's been great. Lots of challenges, but lots of great opportunities as well. And you can see the impact that you make every day.
Yeah. Well, we're all about impact here at HealthIMPACT. So I love that. But it's, I think we always hear about finance and how finance was so far ahead and the data exchange, and we could go to any bank machine and get our money and access things. And that comparison is always made. So I'd love to hear a little bit about, what that was like, going to that transition, from finance to healthcare.
Yeah, it was a little probably eye-opening at the end of the day, to your point. And I think a lot of it had to do with, maybe some of it has to actually do with competition, which sounds like an odd word in healthcare. But, where I came from in the financial services space, and I think if you look at other industries, whether it be hospitality, et cetera, I mean, there's competition. And so your emphasis and your focus on the experience of that consumer can be a differentiator. You clearly need all the back end to work as well, but I think a lot of it has to do with the way you show up and the level of what we know about you, and how we show up every day knowing about you makes a difference. And so I think in healthcare, I think there's a lot of technology catch up that's been happening. And I think now we're kind of at that point where, hey, we really need to think about that patient as a consumer, because they have choice at the end of the day, right? They're going to go where the least friction exists to go address what they need to address. And our opportunity is to create, I think, that really engaging experience for them, to where they'll be more of a proactive participant in their health, as opposed to just being reactive, like I'm sick, I broke my arm or something, right? So how can we get them on a better path for wellness, proactive wellness, as opposed to just dealing with the reactive piece, which we clearly need to build very good experiences there. But I think that's our biggest opportunity to even, not to be too optimistic, but to shape the way things are happening in healthcare today.
Mm-hmm. Yeah, no, it's interesting if you think about money, we care about where our money is, and we think about it often. One would think that we would be engaged in our health in the same way, but a lot of that is the transparency and the ability to see it, right? And to know what's there and how it's moving and if it's going up or down. And now the technology is there for us, like I know my Aura Ring, not to give them a commercial or anything, but any of the devices, I have lots of them, Apple Watch, and has allowed me some transparency into that, that has changed my behavior, almost passively without, taking too much of a, sort of aggressive role in managing that. And I think that all goes back to a lot of its data. And of course, now with this advent of AI and artificial intelligence, which we've been talking about so much, you know, what is possible is truly coming to that place, and whether it's human centered around the care or patient centered. But tell us a little bit about what you guys at Memorial Hermann are doing and in that space.
On the AI space?
Yeah.
Yeah, so a number of things. So I think the way we've looked at AI just holistically is definitely around, I think there's a lot of conversation around whose jobs are going to go away and get replaced with AI. Obviously, a lot that appears in the press that will, make folks think that and have concerns expressed in that space. But I think the way we've approached it within Memorial Hermann is we see AI as a companion to support not just the providers and the clinicians, but actually also the patients as well, right? So a lot of the work that we're doing right now is what can we do if we take a look at the problems to solve in your world every day as a provider or as a clinician, nurse, et cetera. What are things that are administratively heavy? What are things that you take time that maybe impacts your home life because you're charting at night? And so where do we have opportunities to actually apply some of these capabilities? So it's less about, I've got this solution, what problem can I solve? But instead, let's look at your daily life and start to peel some of those things back. So a couple of things that we've been working on, ambient listening, which you hear a lot about, but it's really been impactful for our providers. And we have a large pilot going on right now where a provider can come into a patient's room, have a conversation with him or her, and they have a app on their phone that they sit down, they express to the patient what it's for, and then they just have a normal conversation. Tell me how you're feeling, et cetera. And the application then essentially charts the details of that visit for both the provider to put into the chart as well as a summary for the patient at the end of the day. The early feedback we're getting is for some of our providers, it's saving them an hour to 2 hours a day in charting. But the interesting thing was when we talked to patients about it, they love the fact that my doctor was actually looking at me and wasn't turned filling out the forms and filling out the documentation that he or she needed to fill out. And so they felt a better connection with the patient or with their provider at the end of the day, which is fantastic. So it wasn't about being scared of the AI. They saw it then as hey, this is actually helping our interaction. So
yeah. No, and we've been talking about that for a long time. I mean, I think of the graphic, right, with the physician facing the computer and the patient there, and and even in some ways the pandemic, and I know you mentioned how you started kind of during the pandemic and how all of that, so much of that changed. But even the way that you and I are talking now compared to how this used to be even 4 years ago, right? At the beginning of the pandemic when Zoom, it happened and we would be on Teams or Zoom or whatever and have those conversations. But now the way that we engage with it is different because it's become such a more normal part of our existence, right? I mean, for me, certainly 90% of my meetings are this way as opposed to on the phone now. And for the physician and the provider to be connecting that way naturally, as opposed to literally going through a checklist while the provider is facing a computer, it just engages people totally differently, and I imagine the nature of the conversations even have changed.
yeah, and I think, those kinds of capabilities. And so that we're doing some things with video interaction with a nursing platform that we've been piloting as well in one of our facilities to where there's a virtual nurse that's available. It's an actual nurse, but that nurse is available through a virtual interaction, basically on demand in a patient room. So you think about the immediacy of being available, whereas before I hit my call button and the poor floor nurse that's, running up and down because he or she has several rooms that they're accountable for, and maybe they're in the middle of, taking vitals or whatever. Now you've got basically on-demand access to somebody to answer a question and maybe just to be a voice of, interaction because maybe I'm concerned or whatever. And so I think to your point, you take the Zoom that we're on right now, that level of I'm comfortable with the video interaction. There are times when I want somebody physically there because maybe I need a handheld. But there are times when I just, hey, Megan, I've got a quick question. Can you help me understand this? Or when are my labs coming due? Or when's dinner coming? you can have that level of interaction. And so it provides a level of comfort for patients.
Hmm. Yeah, because, and it's a lot of like, I mean, being in a hospital, it's lonely, it's scary. And to know that, you can have access and it's not just, sort of ringing a button and hoping that they show up and having it take a long time. So the responsiveness, that experience has really transformed. So it's amazing to see. And I think, and as you said, it the benefit outweighs that sort of fear of, kind of, am I not getting the right connection that I need? But there is, of course, some sensitivity to it. I know that you guys have your a governance council in place. What are some of the things that you guys are working on in terms of ensuring responsible tech innovation and adoption?
Yeah, we actually, you mentioned our AI Governance Council. So we actually stood that up about a year ago. And we stood it up because obviously all kinds of opportunities for leveraging and exploring AI were coming at us. And when you think about all of the folks all the gates that you would have to go through in order to get that approved or at least reviewed, it was very episodic as far as who I was able to connect with and did I get all the right folks, all the right touch points happening with the right folks. And so we stood up this AI Governance Council and we started off really establishing what I would consider to be kind of our core framework. And that was around our policy and how AI could be used within our system so that way we had clarity. It was also around our review processes. So what are the kinds of things we wanted to make sure that we asked about any AI that we were exploring? So we developed a pretty extensive checklist, but also where do we inject that AI review in existing processes today, whether it be security reviews, contract reviews, or technology review processes. So that way we weren't doing yet one additional process that would have created red tape, but instead we could inject that into things that already existed today. And then the last one was around education and communication. So how do we educate our staff about the capabilities of AI? But just as importantly, how do we educate our staff on how to have a conversation about AI with patients? So how to be transparent about it, how to let them know that, look, this is a tool to aid in your care. This isn't to replace a nurse. And so really those kinds of talking points. And then obviously communication, just letting our teams know what's going on, and even externally some work we're doing. So our initial team kind of started with that framework and really establishing those core elements. And then what we've done is we've expanded that to, we've got specialty work groups. We've got a clinical specialty work group, a consumer and patient experience work group, and what we'll call an operations work group. And what we have subject matter experts in each of those areas. You can imagine clinical, we have nursing, we have physicians of different specialties, and then they're augmented with our data science leaders, our privacy, legal, and technology teams. So they'll do kind of the nuts and bolts review, but really we're looking for those in the clinical space, for example, to where if you're a cardiologist, would you feel comfortable with the AI doing the following things, maybe not making decisions, but would you be comfortable with the results? And then we also look for them to be advocates for those capabilities across different committees. So instead of just it happening in one area, why shouldn't we be deploying this across all of our hospitals and all of our clinical sites? So that's been very successful. We're running several of our opportunities through things that we want to pilot. And we're also retroactively looking at the things we already have in production today to make sure we're documenting them and to make sure we've covered all the right bases. So.
Wow, that's great. I mean, and there must be a lot of learning that comes from that too. I mean, I think, AI, because it's not new, but it's sort of newly very exciting and everybody is talking about it. And there's always a lot of fear around that and fear about job loss or fear about, lack of human connection. Where would you say in those, with those committees that the learnings have come in terms of kind of balancing that, particularly with the staffing side, right? Where you've got, certainly we've seen nurses, striking and concerned about, replacement versus, augmentation. What is the general consensus and where are you seeing some of the, whether it's a surprise or the points of learning?
Yeah, I think so. One thing is, I think because of the fact that when we were very purposeful about the folks we brought to the table to be part of this council and also the work groups, to where I think the great thing is because we had so many voices at the table, everybody could hear everybody's voice, right? So you heard from our equity, diversity, and inclusion folks about concerns they may or may not have. Obviously, from a technology standpoint, what the implications are there, our security team, our contracting teams, et cetera. So I think the hesitation or the concerns that folks may have had in their respective silos, I think a lot of those get addressed in some of these conversations, and there's some good aha moments. So I think it's seen overall, and I kind of mentioned this early on, is less of a threat. And I think folks are seeing this as, hey, you know what? There's a way we can go about this to test and learn safely, and to make sure that we understand what the potentials are, and we can make sure that we put the right guardrails around either use cases or maybe looking at this going, this may just not be the solution for us.
Right. Yeah, that's great. I mean, I think where the enhancement and the augmentation and the companion tools come in, and now, we talk about the agents and all of that for the nurses and the physicians, it's so different from how, EHR was maybe deployed, right? Like, here it is, this is it, you weren't involved. And now it seems like most health systems in the country are engaging their clinicians in the implementation and where should it be deployed,
Yeah, no, exactly. And that's, they bring, and even we have those physicians, even in some of the other, and the nursing teams as well, our nursing leaders in some of those other work groups, just again, for their perspective, especially on things like patient and consumer engagement potential opportunities, because they're the ones that are likely going to hear about it, right? So I've got some doctors on my team on the informatics side, and they'll tell you every day that they'll go into a patient appointment, and for the first 15-minute appointment, for the first 5 to 7 minutes, they hear about parking and how hard it was to get in, which has nothing to do with the appointment and why they're there clinically. So it's important to understand from them the kinds of questions that they may or may not get, and they can kind of bring those things to the table. So I have found it very beneficial to bring those voices forward because it really helps us dig in and understand. And again, that's part of having broader perspectives as we learn through all this together.
Although parking is a unique challenge at the Texas Medical Center.
I will not argue with you one bit. Somebody thinks that we have some special zones or whatever. We're in the same boat.
If I recall, yes. But yes, no, I hear you. In terms of so getting back to impact, and kind of where are you seeing the, sort of measurable impact and sort of positive outcomes? Are there, sort of programs or implementations that really stand out? And how are you going about kind of doing that evaluation?
Yeah, so it's kind of back to the problems we're trying to solve. So I'll give you a couple of examples. I mentioned the ambiance where we're doing the ambient listening. We're seeing positive results. One, from patient feedback, which is definitely something we pay attention to, but also provider feedback and just the time saved, as well as opportunities potentially to bring in another appointment or two during the day, because access is always a conversation topic. And so I think we're seeing positive results there, even in our pilot. A couple of other things that we actually have in production today. One of those is a voice bot that we use for patient outreach. And so a couple of problems we were trying to solve there. One big one was there just wasn't enough staff to do the level of outreach we needed to do for things like patients that are discharged to home from our emergency departments. Checking to make sure that, because we're obviously trying to prevent readmissions. And so if the patient was sent home, we obviously want them to get a primary care appointment as a follow-up. And then for those patients that were prescribed medications, were they able to pick up the prescription from a pharmacy? And so we were doing that before, especially during COVID, we were doing that with manual folks. Some of us even signed up to make those calls because there just wasn't enough nursing staff to do that. So we actually built a voice bot on a piece of technology from a company called GridSpace that actually does the outreach and has a very conversational interaction with the patient. And if they have not scheduled their primary care appointment, why? So do they not have one, or do they need assistance with one? And then if they did not pick up their prescription, the technology, the voice bot asks why. And then we capture that, and that gives us follow-up then. So, and when you think about the number of phone calls for a hospital system that's got as many hospitals as we have in the city of Houston and the broader Metroplex, that's just a lot of people that we need to reach out to. So we're making probably on a weekly basis 4,000 to 5,000 calls that historically would have been done with people. So, one, we're making the calls that we wouldn't have made otherwise because we just didn't have staff, and then we're actually getting patients connected with primary care providers. In a lot of cases, we're finding medication gaps to where patients can't make it to a pharmacy or they can't afford it, and then we can connect them with our community benefits team. So,
right. Yeah, I think that's probably the area that I hear about that I get most excited about, which is just the stuff that we couldn't do before,
yeah,
because there's just so much low hanging fruit that wasn't, it's just too hard to operationalize. And at the end of the day, the revenue code around it barely exists, and
yeah,
so there might be a downstream implication of finances for sure or risk, but ultimately the money to pay that person to do that, wasn't there. And so now this automates so much of it. And frankly, whether it's, colonoscopy prep or whatever, all the, those calls, they were, you didn't expect them to be your physician, and they weren't necessarily the highest level customer service. So if they're
right.
automated, it's okay. It's
Yeah, and
not.
especially there are a couple things that we do with any of this technology. We make sure that the voice bot, her voice comes across as a female, so she announces herself as part of the virtual care team, and she explicitly states that she is a voice or virtual care assistant. So we're transparent there, but she sounds very conversational. And when you listen to some of the calls, we have patients. We had one patient that spent 6 minutes describing what her experience was like, and the voice bot just listened and said, well, thank you, and captured all that. So
Right.
when you think about some poor person that would have been on the other end of the phone looking at their call list going, I've got 50 more calls to make. And,
Right. Well, just that alone. I mean, if you think about the measured impact of that, right? I mean, just time saved and all of that. It is interesting and kind of crazy. I mean, and it is, and the way the technology is just getting better and better. I mean, I've heard some of the, just the podcasts that people are starting to put together, and it's crazy, and it will get to the point where we can't tell the difference, in many cases, so good or bad. But there's that when you talk about loneliness in healthcare too, and fear and all of that just talking to someone helps, whether it's a real person or not sometimes. So
yeah, I think there's an opportunity to build that concept of a care companion that's with you all the time. You think
Mhm.
about, we were talking about banking earlier in our conversation, the fact that I can pick up my phone and look at any point in time and understand my balances, where my money is going. There may be a day, and I would love to see a day when we have that option to where somebody has a virtual care companion to where, whether it's through chat, whether it's through voice, they can ask questions and to your point, maybe just have a conversation or express some concern or fear. But again, I think to the point of, where do what's the marrying point between efficiency and the human centricity? Always having that opportunity to escalate to a human, to where if it's like either the technology, the AI recognizes that Megan's not in a good place and I need to connect her with somebody that can really dive deep, right? Versus, just the opportunity to have an engagement with, I guess, a thing at the end of the day. So.
right. Yeah, no. And what about, I mean, to that extent, it's not all pie in the sky. It's certainly not all easy. What are have there been any kind of either unexpected challenges or kind of those big like aha moments where you're like, okay, wait, this isn't going to work?
Yeah, I think a couple of things. One is we still run into situations around explainability, because I don't think any of us feel comfortable, especially in healthcare, with a black box. And so making sure that, especially as we work with some of these early stage companies and exploring their platforms and their solutions, really making sure that there's a level of explainability there that they have that we can also then feel comfortable with. So I think that's one area. I think there's still a little bit of what's going to be the true return on this? What's the benefit I'm going to get out of it for the cost? I think we also, for again, some of the earlier stage companies, but also as we take a look at, because AI is not cheap as far as the compute that's required on the back end. And so really understanding what the true cost is, and then being able to, as you kind of mentioned early on, what's the true return that I'm getting? And it could be outcomes based, it could be financial based, whatever. But I think we've seen scenarios to where the cost is a little bit cloudy. And, I can't really go to my CFO and say, trust me on this one. I feel good about it when you got thin operating margins, right? So there's got to be an element of predictability around the cost. And I think we continue to see some challenges in that space. So,
well, and it's like healthcare is so slow to change, but as soon as we do, we want to see an ROI.
100%. And our chief operating officer and our CFO will tell you the same thing. I mean, and that's fair. And that's what we really have to look at. And that really goes back to, we talked earlier about just the problem to solve. And so making sure that we're aligning those, less about, again, shiny objects and more around true problems that we're trying to address. And so some of the things we're really targeting and we're looking at AI is how can we actually go address those? Because a lot of those come around cost reduction, outcomes, improvement, et cetera.
Right. So what are you in looking at the programs, whether they're starting to deliver that ROI or they're just, you can tell they're really working. What are some of the ones that you're most excited about right now?
I think really the ones that have been, you mentioned earlier, the low hanging fruit. I think the patient facing solutions are just, they're easy because of the fact that you can do a pretty quick offset. But also we're seeing one of the other things we're using some of our patient engaging AI for our voice bots and also messaging based is just to help patients action things like annual wellness visits and other gaps in care. And so with these technologies, we're actually seeing lift in those areas. And so I think that's one that we're excited about as far as what the opportunities are and continue to build on that, because if we can get in a regular routine to where we're using those kinds of platforms to solve those needs, again, very low hanging fruit, but gives you very positive returns and very easy to measure. So.
Yeah, I think that, a lot of that in terms of the just easy to measure and high impact is really amazing. Around kind of putting your forward-looking glasses on and sort of what's the, what do you think, we're sitting here, this has all happened pretty fast with the pandemic and then, sort of virtual care. And then obviously with the advent of the large language models and the acceptance of AI, and now it's just kind of part of our general dialogue. As you look to 2 years from now, 5 years from now, what do you think, what are we going to be talking about then? Where is this going to go in terms of how AI and human-centered care really, kind of converge?
One of the things that I realized in healthcare, and I think a lot of that I saw as in financial services, that industry does a very good job, and definitely in other industries that are very consumer-centric, is really empowering or leveraging the data to empower consumers. And so I think that's one thing we have not done. There's this incredible trove of data and information that's sitting in our EHRs today that could help you manage your health better by taking actionable steps and really guiding you along the way. I think that, to me, that's very much a next frontier to where how do we take all of that and not only empower the provider, but instead of having to go through and read 10 years of a chart summary, being able to summarize and say, Eric has been doing well in his weight management. He's doing well in this. He's been taking his medications, but this area he needs to improve on, right? Maybe exercising a bit more based off the feedback he's given in the past 3 or 4 visits. Being able to have that in summary right in front of the provider to where I can now have a very informed conversation as a provider to a patient, I think is huge. But I also think that's empowering also from the patient's perspective to where now I'm going to give you actionable steps on things you do. So I give you nudges each day in a channel that you will respond to. So not everything may show up in your mobile app, but instead you respond a lot better to nudges via text because it's in front of you, you're looking at it all the time. So our ability to understand and have the AI understand what actions you best respond to with which modalities, coupled with all that data on the back end, I think that in the next, hopefully less than 5 years, but I think we're going to see some huge advancements in that space.
Yeah. I mean, it is amazing to see, just the sort of leapfrog that we've had in terms of, sort of the right care at the right time, and then the personalization piece of it, right? That customization to give people what they will respond to.
Yep, exactly.
Well, I think that's a great place for us to close, unless you had any, world pearls of wisdom you wanted to share, or, kind of advice for those kind of embarking on that journey, today.
Yeah, no, I think, if there's any, I don't know how much wisdom I would call it, but maybe lessons learned. So maybe, a few skinned knees here and there. But I think first and foremost, don't be afraid of pilots. I think it's really helped us learn. I would say at the onset, invest the time up front. It's not sexy, nobody likes it, but the whole governance process, especially given where we are from a regulatory standpoint, there's a lot of ambiguity there. So as a system, you getting in front of that to be able to establish that with the right set of players at the table will help you, I think, do the right level of analysis to where you can experiment and learn, but also have the infrastructure in place to actually scale. But the last thing I would say is, and the thing we found is you could pilot yourself to death. So figure out those problems to solve, find those technologies, pilot them, but get them out the door because I would tell you your employees and all of our patients are looking for that and they're expecting that at the end of the day.
Mm-hmm. So both at the same time, don't be afraid of pilots, but be wary of those that maybe go on too long and get the answers you need at the right time, right?
Exactly.
Well, thank you so much. I really enjoyed speaking to you today, Eric. It's great to see that the work that you're doing, and it's just such an important part of where healthcare is going in terms of this human-centered AI applications. So thank you.
Thank you, Megan. Enjoyed the conversation.
Absolutely. And I want to thank our audience. Please feel free to reach out to Eric and to myself with any questions. And, join us in the future on Digital Health Talks. This is Megan Antonelli signing off.